Hi, I'm Dr. Charmaine Chibar. I'm a pediatrician who's been in practice for 20 years now. And believe it or not, I did not like science very much before this. I had a fantastic biology teacher who tried to make connections between real life and the science. And for some reason, that connected and stood with me. And I'm like, it makes sense. So I initially thought maybe I could be a nurse. My mom was a nurse. I actually looked into physical therapy. I looked into nursing before I came back around and said, okay, I think I can do medicine. I can be a physician. And when I did my rotations, I found that when I did the OB rotation, I wanted to follow the baby out of the room and didn't necessarily want to stay with mom. So the International Day of Women and Girls in Science is special to me because I feel like at the time that I was growing up, I didn't see as many women in scientific fields. I didn't have as many role models that I looked to at that time. So I respect that there is more openness for that and that there are more girls being introduced in the scientific fields and being encouraged to go into scientific fields. I think I enjoy the gamut of pediatrics. I think people ask me, what do I prefer, if I prefer the newborns versus the teenagers? And I think I love them all. I love watching the transition, love the babies, but I love watching the transition as they grow and seeing them turn into young adults and the maturity. And when I can say to them, see, remember when I told you? So I enjoy that part of it. That's actually my biggest thing, is watching them grow in that continuity and watching them mature. And in some cases, having them bring their kids to see me, which I still haven't gotten used to that idea yet. The idea that they trust you enough and they remembered you and think, I want my kid to see you too, it's humbling and rewarding. I think we feel like we have to be perfect. And I think we beat ourselves up a lot of times when we think we haven't done it right. There's a lot of social media and things out there that tell you it has to be done this way, and if you don't do it this way, all these bad things are going to happen. There's no one right answer. You got to find what works for you and your family, and it evolves as they grow and as they change. It evolves. So whole good care for me means taking care of the whole child, including the village that supports the child. So exceptional health care for every child. That's actually a personal one for me. As an immigrant who came to this country with no health care, my first set of health care was at the health department downtown West Palm Beach, where I got my vaccines when we first started. I barely remember going to the doctor when I came here, and I came here when I was 12. We only went to see the doctor when we were sick and needed a note. So I do not remember getting checkups. I didn't know that was a thing, that you did yearly checkups and things like that. And so for me, I would love for families that don't have financial access to those things to still be able to get those check-ins once a year. I think is exceptionally important, even if we don't have the financial means to be able to do that. So for me, it's giving back to my younger self. So that's what that means for me.